Hi, welcome to Deep Sea Foundation YouTube channel, where we talk about all options for breast reconstruction and various topics on breast reconstruction after mastectomy. My name is Terry Kuti, and I'm here today with Mary and Caroline. They both had their breast reconstruction done in Ohio, and we're at the home of Mary today. Thank you for being such a great hostess.
Sure.
We are at the home of Mary today, and each of these women finalized their breast reconstruction with tattoos. They have unique and individual stories. Caroline, can you start by telling us what the final process of your breast reconstruction was with your tattoo?
Absolutely.
Yeah.
So when I finished, I had 3 surgeries to get to where I was comfortable with my shape. I had no nipple sparing reconstruction. That I started out larger, and my plastic surgeon didn't think that would work to keep them, as well as a little bit of the not, having any extra cancer risk by having any nipple, tissue that might have breast tissue connected to it. So I originally wanted to keep my nipples, but that didn't seem like a good plan.
You have to think through all that, don't you?
Yeah.
Look at the research.
Yeah, I had to decide that
Peace of
okay.
mind.
And he didn't think it was going to aesthetically turn out well for me if I tried to keep them. So
All good talking points.
So let that go. And then looked at whether or not to do the surgical reconstruction to get a nipple with projection and do tattooing, or just do tattooing. I remember that kind of went back and forth in my head for a while. Like, do I want 3D projection? And I decided that I really didn't like when I had headlights in clothing. Like, if it was showing,
Right.
I was a little self-conscious, and even being big-chested, I kind of would tend to wear a bra that would hide that, so that I wouldn't be showing that. I kind of like the idea that having seen 3D tattoos done, they could look real. They could look like I had projection and not have any, like I could wear a t-shirt and not be in headlights. I kind of like that idea.
Yeah.
And I had seen a show on TV where one of the Cleveland anchors had done their tattooing with Vinnie Myers in Baltimore, and
The
looked him up.
tattoo, the nipple and areola tattoo guru.
Yep. And so he had national kind of he'd been apparently part of I think it was John Hopkins, working with the plastic surgeon
Okay.
over there.
Okay.
That's what I learned from him. That's how he got involved. And I think his sister even had breast cancer. So he felt very motivated to keep that tradition of making his tattoo
Kind of
practice.
a legacy for,
Yeah. Felt kind of
His
called for
mission.
that.
yeah.
So I looked up his pictures, looked up his, what work he had done,
Mhm.
and said, I'm going to Baltimore. And so I actually had to reschedule it because I had thought it was going to happen after a second surgery, and I went back for a third for better shape and such. And he was gracious enough to push back my appointment. He wanted me ready when I was ready, and he was great. My husband sat with me during it. I was a little kind of intimidated. First time I'd been in a tattoo parlor. I remember saying, I'd never get a tattoo. And he goes, I never say never.
I know, isn't that amazing? I hear other women say
Yeah,
that,
like-
and there they are.
And it wasn't that I thought tattoos were ugly or not okay. I just knew that I would want to change it. Like,
Yeah.
I'd be like, I'd want artwork on me. I don't mind being painted with, someone could do a temporary tattoo. I'd be fine with that. But the idea to have something permanent and to not be able to change it, I realized that once I got my nipples back and I could see them, that was like the most healing thing. It was so amazing to me that when he put the collar on and I could then look down or look in the mirror, or just changing clothes, or in front of my husband, or at the fitness center getting into my swimsuit, I felt whole again. It was so life-changing to have 3D nipples that even my OB doctor who looked at me would have not guessed that wasn't my own nipple. It was very, very healing process to get that done.
That's an amazing story. Thank you for sharing that.
Absolutely.
Mary, I know you have a similar but different story.
Same but different, yes.
Same but different. Let's hear yours.
Well, I had breast reconstruction surgery here in Columbus, Ohio. I'm a little bit different. I had a single mastectomy with deep flap reconstruction on my right side. So I have a left natural native breast, but I have a deep flap reconstruction on my right. So lots of different issues if you've just had a single mastectomy with a single deep flap. I did not have nipple sparing. So I began exploring whether or not I wanted to do a 3D nipple tattoo or some surgical reconstruction of my nipple areola with some tattooing on top of that. My surgeon, he was very upfront with me that sometimes the surgical nipple areola procedures, sometimes they flatten out over time. So I thought, well, I think I just want to do a 3D nipple tattoo and call it a day. So we have a woman here locally, Christina Johnson Siegel. She owns Living Story Tattoo, and she's made it her life mission to learn how to tattoo women and do it with a high level of professionalism to restore that visual aesthetic for women who've had reconstruction, who've been through breast cancer. So I had a little bit different challenges here. You cannot see my nipple areola on my right through clothing. It's completely flat. So I have to have some coverage on my left side so I can conceal the one headlight that comes on sometimes and the other headlight that never comes on.
Depending on what clothing you're wearing.
Depending on clothing you wear.
Yeah, absolutely.
But that's a side issue. But to make a long story short, we did 3D nipple tattooing on the right. It looked really amazing. I will say that it can be challenging over time to sometimes my tattoo has lightened up over time, and I've had it redone a couple of times. And I appreciate Christina's artistry and concern with not getting it too dark and making sure that it will match my other side. And she understands that, and I understand that it's a process over time. I've just recently had my tattoo darkened by Christina, and it's such a great match for the other side. I could probably go to a topless beach and no one would ever know.
I think you should find one.
Right.
I
mean, she's just taken so much care with my tattoo. Both times that she's worked with me, and I just really enjoy working with her. She's an artist, and she approaches it in a way that, as a cancer patient, you really appreciate the care that she's put into it, and I'm very, very happy with the work she's done with me. So,
listening to both of your stories, I think about 3 words when I hear your stories. Symmetry, art, and healing.
Yes,
absolutely.
And I think that's what whether it's a decorative tattoo or a nipple and areola tattoo after breast reconstruction, I think you're hitting on all 3 of those elements: symmetry, art, and healing. Ladies, thank you so much for sharing your story today and for helping to educate others.
Absolutely.
And please like our videos. We always appreciate that. And comment. Let us know what other topics you would like us to cover at Deep Sea Foundation. Thanks so much for watching.
Thank you.
thank you.
Thanks, ladies.